One thing that I go over with every one of my personal clients is the difference between Medicare Supplements and Medicare Advantage. Let's face it, every senior is overwhelmed with options. Just in my home state, there's over 30 different options for Medicare Advantage plans this year, 10 to 20 different Part D plans, and dozens of insurance companies that offer Medicare Supplements, and then they have A through J, K, or L. So dozens and dozens and dozens of options. So everybody wants to streamline it. Everybody wants a shortcut. And they all say, Sylvia, just give me the best plan. There is no best plan. Oh, how I wish there were. There are good plans that fit different people differently. So it's great to have a lot of different tools in my toolbox here. Medicare Advantage and Medicare Supplement are both great plans. I put my mother on one plan, I put my father on the other plan. One fit him much better. She, based on her health, how she doctors, how much she travels, another one fit her better. So let's just talk about the differences between Medicare Advantage and Medicare Supplement. Okay? Medicare Supplement, I like to call this a Cadillac plan. It's a Cadillac because it is extremely flexible. You can go to any doctor that accepts Medicare, any hospital in the nation. You're not restrained by any type of network. You're going to pay a flat fee monthly, so it's great if you want to know your budget to a T. You'll know exactly how much you pay a month. So I'm saying $120 a month. This is going to vary based on where you live in the country, your age, whether you smoke, male or female. That's a good rule of thumb to say a 70-year-old is going to be around $120, $130 a month. And then you'll also have on top of that your drug coverage, another $30 a month on average. So a flat $150 a month that you know you'll spend every month. Each and every month, all year, whether you use it or not. That's the key. Okay, versus Medicare Advantage plans. Medicare Advantage plans, like I said, there's many different plans based on where you live in the country, but these are the most popular plans, zero premium. So you would have zero monthly premium, and many of these plans have the drugs rolled in, so it's your Medicare Advantage and your Part D, MAPD together, both for $0 a month. So over here where I said that you had complete knowledge of what your budget will be every month, because you know you're going to pay $150 whether you use it or not, over here you have no idea really how much you're going to spend a month. If you don't use it at all, clearly you're going to spend $0 in premium. But if you use it a lot, you're going to pay as you go. So I love the scenario of envisioning these two separate products. Medicare Advantage is an a la carte restaurant. A la carte. When you go to an a la carte restaurant, say MCL Cafeterias, one of my favorites, you pay as you go. If you get the corn, the potatoes, you pay for the turkey, you want pecan pie, you want Jell-O. My kids bankrupt me because they want to put every single thing on their tray. I'm pretty cheap to feed there because I only want the pecan pie, I want some milk, and I like mashed potatoes. You know, very cheap. Just pay for what you use. When you go Med Advantage, you're going to pay what you use. So, for example, like I said, this varies tremendously on what product you buy, where you are in the country. But in general, to see a regular family doctor, about $10 a month. $10 a visit. To see a specialist, maybe $20 to $30. Go to the emergency room, maybe $70 to $100. What really gets expensive if you are in the hospital overnight, and that could be anywhere from, let's say, $100 to $250 per night. Many different limitations based on the policy, but you get the point. You pay as you go. If you don't use it at all, you have zero cost that month. Versus a Medicare Supplement, it's going to be a flat fee. Every month I'm going to pay that flat monthly premium for a year, and it's going to be the same whether I use it or not. So if I have open heart surgery, I need a transplant, I need my leg amputated and a prosthetic and therapy, it's still going to cost me $120 a month. The downside of that is, if you're like my dad and you never go to the doctor, you're paying $120 a month, each and every month. So you look at somebody that goes to the doctor twice a year, how much were they actually paying for that doctor visit? Because they'll say, oh, it's free. When they actually go to the doctor, they're not digging in their pocket for a copay. They don't pay anything at the doctor, so they love that. But what's their actual cost, right? So their actual visit was costing them $500 if they went twice. They might be a lot happier with a Medicare Advantage plan, where if they only went to the doctor twice, and it was a regular family doctor, they went twice last year, their total cost out of pocket would have been $20. Now they would have had to dig in their pocket for that copay, and some people just don't like that. They don't like having to get their checkbook out or get some cash out every time. It's just not for them. they'll pay more for the flexibility of having it all paid for and having a set budget. And then also the big difference is, of course, your access to providers. With a Medicare supplement, you can go to any doctor, any hospital that accepts Medicare, so it's completely flexible all across the nation. You can put it in your pocket and go out traveling and you know you're not going to have trouble. With Medicare Advantage, depending on the type of product that you bought, and there's many different types of products that fall under the Medicare Advantage umbrella. Private fee-for-service, PPO, HMO, cost plans, there's many different types of plans. Some have a much wider range of doctors that you're eligible to see. Some are a lot more restrictive, like the HMO model. So depending on which type of plan you have, you might not want to travel. It might be too much of a hassle. Or you might not want to take the risk of spending 6 months a year in Florida at your second house. This might be a better fit for you. Budget is always a big consideration, right? This is $120 a month. This is $0 a month. Which one's cheaper? What's the bottom line? Like I said, everybody wants a shortcut. I don't know what's the bottom line. I don't know what your actual cost will be. If you can tell me with certainty how much medical care you're going to need this year, you're going to go to the ER, you're going to break your wrist, you had bronchitis in the winter. If you can tell me with certainty, I can tell you exactly how much it would cost you here and which plan will be better, but you can't. So I can't tell you which one's actually going to save you the most money. You can look at your past history and see based on the last 5 years which one would have come out more economically for you. But insurance is all about risk and what you feel comfortable with. So the total risk right here is at 120 times 12. Your total risk on Medicare Advantage, of course, is going to be the floor. Most plans have a ceiling, and we'll see every plan have a ceiling soon. I think legislation is coming where that you can't pay more than a certain amount, typically $3,000 to $5,000. Once you hit that amount, you wouldn't pay any more of the year. So if this plan is a $4,000 plan, and we know over here this plan's a $1,400 plan, we can see you have double the risk, but you also take the risk that you would save more money on this side. So I go back to what I started with. There's no best plan. There's a lot of good plans. There's a lot of good tools that we as insurance agents have to serve our clients. We need to talk to each client as an individual. And like I said, like my parents, I don't necessarily sell the husband and the wife the same plan. And that's one thing that people get confused about. They said, Sylvia, I really liked you. I really liked what you sold me. Can you talk to my sister? And then I go and sell their sister something completely different. Then they're flummoxed and they're saying, well, which one of us got ripped off? Which was the best plan? You know, there is no best plan. I'm going to look at you as a client, look at your health, how you doctor, your budget, what you feel more comfortable with. Like I said, can be more inexpensive, but you're just not comfortable digging in your pocket for those copays as you go along. You like the certainty of knowing what your budget's going to be. Based on your comfort level, we can recommend what plan that we feel is going to be best for you. Talk to us at Gordon Marketing. Talk to your independent insurance agents. We want to serve you.